Unit 10, Central Nervous System. The central nervous system includes the brain and spinal column. As such, both mental and physical disease processes and illnesses may occur within the system. Drug classes which are used to treat disease processes and illnesses of the central nervous system, along with applicable laboratory tests and patient education, are discussed. Here are your objectives, and these are your reading assignments. Sedatives and hypnotics. Although these terms are used interchangeably, sedatives and hypnotics are actually different. Sedatives are drugs that have inhibitory effect on the central nervous system. So these drugs depress the nervous system. In addition, it also induces relaxation and decreases anxiety. So this is considered anxiolytic or medication that's used for nervousness. That being said, at times it causes sedation when given at higher doses. Hypnotics, on the other hand, cause sleep. So this is much more potent than sedatives. So it is an upper end of sedation. It can induce coma or sleep. General precautions and contraindications when administering sedatives or hypnotics. We need to take in consideration that sedatives or hypnotics can decrease the level of consciousness of the patient. In addition, it can cause respiratory insufficiency. As a result, this can also increase the patient's risk for injury. Some general nursing actions include assessment of therapeutic and side effects, monitoring level of consciousness, respiratory function, blood pressure, and making sure that the patient is safe. Patient education, definitely it's very important to inform the patient regarding the drug, and if this is a drug that requires blood draw or monitoring the levels of the drug, then this is also something that we need to inform the patient about. Some potential issues: physical and psychological dependence, especially when it comes to certain classes that are considered opioids or narcotics. One of them can be your benzodiazepine. So again, this can cause physical and psychological dependence. Together with that, they may experience withdrawal symptoms, especially when they stop taking the medication after being on the medication for quite some time. Psychological disturbances can happen during withdrawal symptoms. That includes anxiety, insomnia, and it can also lead to fever, tachycardia, both increase or decrease in blood pressure. There are different drug classes that are considered sedatives or hypnotics. Some of them include barbiturates, benzodiazepines, and non-benzodiazepines. Let's first talk about barbiturates. Barbiturates are potent CNS or central nervous system depressants. So it decreases the nerve transmission, and in addition, it also increases seizure threshold. So what does it mean when we say increasing seizure threshold? So this basically decreases the susceptibility of a person to have a seizure episode. So depending on the dose of the medication that we're giving, it can have different effects. These are the action depending on the dose. When given at low dose, this can be used for anti-anxiety, and it can cause drowsiness and sedation. In moderate dose, this can be an anti-seizure medication. On a high dose, this can be used as anesthesia and used to induce coma. Because this affects the CNS or central nervous system, so basically it decreases or depresses the central nervous system. Some side effects include decrease in respiratory rate, decrease in blood pressure, and lethargy. These drugs are considered enzyme inducers. So these drugs increase the metabolism of certain drugs by the liver. Some medications get metabolized more quickly, therefore shortening the duration of action, which then will require increased doses of medication to achieve the same therapeutic response. Here are the examples of drugs under this class, and the drug class that you need to know is phenobarbital or luminol. Phenobarbital or luminol can actually increase the alcohol's sedative effects, which can lead to increased lethargy. Phenobarbital's therapeutic drug level is 10 to 40 micrograms per ml. Next drugs are your benzodiazepines. So benzodiazepines are also considered CNS depressants. Therapeutic effects and indications for benzodiazepines include being the drug of choice for anxiety, sedation, insomnia, and skeletal muscle relaxation. Side effects include headaches, drowsiness, and some hangover effects. So we need to make sure that we educate our patient to avoid the use of alcohol if they are on these medications. It can also cause paradoxical excitement or nervousness. So this is basically not a normal response, right? If you look at it, it is actually the opposite of what we're trying to achieve. So this effect is not normal, but it can happen. So some nursing actions. So we need to make sure that we ourselves are administering for the correct use, and at the same time, we need to educate our patient pertaining the use of these medications. In addition to that, we need to educate our patients regarding patient safety. So again, these are CNS depressants, therefore, it can increase the patient's risk for falling, injury, and so on. Because there is a chance of overdose, in case of overdose, we need to remember the reversal agent. The reversal agent for benzodiazepines is romazicon or flumazenil. Again, the reversal agent for benzodiazepines or the antidote for benzodiazepines is romazicon or flumazenil. Lastly, we need to remember that this medication affects the sleep cycle, so patient may have a daytime drowsiness because it depresses the CNS. Examples of drugs that we have to remember. So we have lorazepam, clonazepam, temazepam, midazolam, and alprazolam. As you can see, most medications end in PAM or LAM. The medications that you have to remember include lorazepam, which is usually used for panic attacks, anxiety, as well as seizure. So lorazepam is actually the drug that we administer whenever a patient is having a seizure episode. So again, this is not only used for panic attacks or anxiety, but these are also used for seizures because of its effect to the central nervous system. Other medications again include clonazepam. Temazepam is usually used for sleep. Midazolam has an amnesiac side effect, and so it will cause the patient to forget what happened prior. It's often used in outpatient procedures as well as continuous infusion for sedation in the critical care unit. Alprazolam is commonly used for anxiety or panic attacks. Non-benzodiazepines. So these drugs, although they're not benzodiazepines, they actually work very similarly to benzos. However, they cause less disruption to normal sleep and they lack the sedative and dependency potential as opposite to the benzodiazepine, which can increase the potential for dependency or addiction. So therapeutic effects of non-benzodiazepine include they're considered anxiolytics, so these medications decrease anxiety, and they also help treat insomnia because it induces sleep. Some side effects are very specific. For Ambien, which is zolpidem, it can make the patient sleepwalk, sleep eat, or sleep drive. So this is a safety thing, right? So we need to educate our patients that this can happen, and maybe especially when they're first on this medication, we need to educate them, to have somebody with them, and maybe have somebody monitor them to make sure that that doesn't happen, because then again, this is a safety concern. Buspar or buspirone, this medication can interact with grapefruit juice. So administering this medication while the patient drinks grapefruit juice, this can increase the drug concentration. So we need to again educate our patient pertaining that interaction. Nursing actions include safety with Ambien and dietary guidelines with Buspar or buspirone. Examples of drugs under this class include Ambien or zolpidem, buspirone or Buspar.